Hi, I'm Rachel Fay. I'm the Director of Public Policy here at Power to Decide, and I'm here to tell you why the rule that was posted today from the Trump administration, what we call the Domestic Gag Rule, is so bad. So, as many of you probably know, the Title X Family Planning Program is a program that provides low-income women with contraceptive services and supplies, either free or at extremely low cost. And what many of you probably don't realize is that, like me, at some point in your life, if you walked into a clinic, say a Planned Parenthood or a community health center, and said, I need contraception and I can't afford it, it might have been, in all likelihood, Title X that was actually covering the cost of that clinic providing you with that contraception at a very discounted price or free. So it's hugely important, and 4 million women depend on this program every year for their contraceptive services. What this rule today did was make it extremely hard for the providers that currently provide Title X services and do it really well to stay participating in the program. And that's because the rule does three main things. It requires that any provider who also provides abortion can only get Title X dollars if they provide abortion at a physically separate site. Think about how crazy that is. When you go to the doctor for your well woman visit, you don't get your birth control in one building and then walk 3 buildings over to get your STI testing, right? It happens in the same appointment. That's just not how reproductive health care works. On top of that, it no longer requires providers to counsel pregnant women on their full range of options in a non-directive way. What does that mean? Typically, Title X has in the past required that a provider counsel a pregnant woman on her options to parent, adopt, or terminate the pregnancy. And now, providers are no longer required to talk about pregnancy termination, i.e. abortion, which means that the woman might not be getting the full information that she needs about her options. That's a violation of medical ethics. And on top of that, providers are no longer allowed to refer for abortion. So if a woman wants an abortion, she can't get the information she needs to go and get one. That's part of why we're calling it the gag rule, because providers are not allowed to give information that they should be allowed to give. So that is, in a nutshell, what they're doing. What does that actually mean? Right now, for example, Planned Parenthood covers over 40% of all Title X patients. And the rule, the way it's written, would essentially block them and a lot of other providers from being able to participate in the Title X program. What that means is those clinics could close or not be able to take uninsured patients who depend on Title X. And we already have 19 million women who live in contraceptive deserts, where they don't have reasonable access to a clinic that offers the full range of birth control methods. If we make it even harder by fundamentally injuring the Title X network so that those clinics aren't there for women who need them, we're only going to make the problem 1,000 times worse.